Grew up in a little small town in Louisiana, Greensburg, about 100 miles south of Jackson. Went to undergraduate school at LSU in Baton Rouge and then on to medical school in New Orleans, 4 years there. Went to North Carolina to live in Greensboro, North Carolina, where I did my internal medicine training. I was strongly influenced by a family practitioner in my hometown, so he was sort of my idol. So I wanted to be everything like him. And I actually went to my training program to do family medicine, but then I realized my love was taking care of adults, and I also thought that I would end up being back in my wife's hometown of Jackson, Mississippi, and I thought internal medicine would be a better fix. So I always wanted to be someone's doctor. In primary care, anything can walk in the door. So we see a whole smattering of acute illnesses such as respiratory illnesses or GI bugs to the chronic illnesses. Being in geriatrics, I tend to see more of the elderly patients who have multiple medical problems, not just one. I even take care of patients in the nursing home, oftentimes after they leave the hospital. So it's a wide range of people that I treat with multiple problems. So geriatrics generally applies more to the treatment of people over the age of 65. And in that population group, unfortunately, dementia or memory loss is one of our major concerns. So we see lots of people who are beginning to struggle with that, and lots of family members come in with their loved ones as they begin to notice that their short-term memory begins to fail. So that is a common problem, something that we deal with. We don't have easy solutions. It's multifactorial, it's multi-treatment. You're not just looking at the disease process, you're looking at their living arrangement, who helps care for them, whether they can drive their car anymore, safety concerns. So safety concerns becomes one of the main things that we're dealing with. Falls in the elderly are a major problem and is the number one reason that a lot of people end up going to the nursing home. I just think people want to be treated the way I would want to be treated. So nobody likes to wait. So everybody wants to be heard, everybody wants to be listened to, everyone wants to feel that what they say is important and that we care. So it's kind of simple. It's just I've always enjoyed being a doctor. I become friends with my patients. I've been practicing for 36 years, and so many of the people I see, I've been with them for 30 years. So it's kind of like a friendship visit when folks come to see me. I have a focus on prevention, preventive care. I like to keep people out of the hospital. I like people to be healthy. So I'm a person who talks to patients about lowering their cholesterol and keeping their blood pressure normal and having excellent diabetes control and not smoking cigarettes and wearing seat belts, all the safety features that help us live longer, healthier, happier lives.